Hello, I'm Sandy Potter, and joining me once again today are Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all stand together to help prevent the spread of coronavirus. Dr. Schwartz, let's start with you. It seems like every day we're getting more positive news about a vaccine being available soon. Can you talk about the steps we're taking here at Masonicare to prepare for distribution?
Yes, I can, Sandy. And, December is going to be a very big month regarding vaccinations for COVID-19. And last week, I talked to you about the three main vaccinations that are up for approval by the FDA for emergency use. Pfizer, which is scheduled for December 10th. Moderna, you probably heard, put in an application for emergency use just a couple of days ago, and they're scheduled for review December 17th, and AstraZeneca as well will probably be reviewed before the end of the year. So you see, things are moving quite quickly. And it doesn't mean that, instantaneously everybody is going to be immunized, but it does show that we need to prepare and we need to have a plan. And I think just yesterday, the CDC announced recommendations that healthcare workers and those in nursing facilities, residents in nursing facilities, would get priority for the vaccine. So obviously we need to take steps, we need to be prepared. And in that regard, we formulated a COVID vaccine task force, which I'm proud to be the chair of, and working closely with key leaders throughout the continuum to try to really focus on a smooth administration of the vaccine when it becomes available. And really the focus of the committee is to look for any issues that might come up throughout the continuum and have a smooth process, and to keep abreast of the recommendations of the CDC. And I'm very honored to be working with these fine people, and I'm sure working as a team will come up with a very safe, smooth, and streamlined process. And the way I like to do things, I like to come up with a quote if possible. I'm starting to run out of quotes, but I do have one inspirational quote this week from a famous hockey player, Wayne Gretzky. Many of you may know Wayne Gretzky, but he was a hockey player from the 1970s to 90s, and I think he ended his career working for the New York Rangers. But he once said, "The only shots I regret are the ones I never took at all." So from me to you, I'm just saying, have no regrets. When the COVID-19 vaccine comes, take your shots, protect yourselves and those you love. Thank you.
Thank you so much, Dr. Schwartz. We love your quotes. And JP, even after vaccine distribution begins, we all still have to be very vigilant. What are you hearing about best practices?
Well, Sandy, the vaccine, as it starts to roll out, it's going to take quite a long time for the vaccine to really get out to the general public. And we've heard that many individuals may not really see it until early summer. And what does that mean to all of us is we still have to stay vigilant in wearing our masks, being socially distanced. Not having large gatherings still needs to be part of the equation. The more we are in really being consistent and be vigilant, I think we have a better opportunity to fight this and continue to stay ahead of it. At no time should we let our guard down. We still have a very significant holiday month that we are fighting through. And what I would ask really all of us is that the vaccine's going to take a while for it to be completely distributed across the country. And we need to do everything we can to continue to mitigate the spread through mask wearing, social distancing, the large parties, or even small gatherings have become somewhat of an issue. So we would love to ask everybody to continue to be vigilant. I am very excited that the vaccine is here or will be here soon. I am excited that we will be able to administer it to those that we serve and our employees. But that isn't the end all to be all of a cure, if you will. It will take us a long time still to battle this terrible virus. I'd also, Sandy, just like to give a shout out to all of our employees. This has been an extremely stressful time, a challenging time for all of my teammates. And there is hope for the vaccine to be here, but our staff have truly done an amazing job at combating this virus, and will continue to do everything that they can to take care of those that we're entrusted to serve. Cindy, if you'll allow me just a few more seconds to talk about a story that just happened recently with one of our teammates. One of our teammates was caring for one of our residents, and our resident was caring for that staff member was caring for that resident, and the resident wanted to do a Zoom with the family. And in the process of doing the Zoom with the family, the resident wanted to pray and was looking for the rosary beads. And our staff member pulled out hers and prayed with her during that. And many of you have heard me say this, it's the little things that make such a difference to those that we serve. This is a perfect example of that. Our employees are really our angels. They are the angels on the shoulders of everybody that they're taking care of. And I just wanted to tell that story and again, tell everybody to be vigilant, be able to, again, wear that mask, social distancing, avoid gatherings, because if we do that, we are going to get over the hump. This vaccine will help us, but help us by reducing that spread, by doing the things that we're asking. Thank you, Sandy.
Thank you so much for sharing that beautiful story. It is a great reminder of what we are all here to do, which is to really take care of those that we serve, and that we're all in this together for a little while longer now, and we can just all stand together and stay strong, get through this. Well, thank you both so much for sharing your time with us today and all of this important information. And thank you for watching at home. We hope you'll stay safe and stay well.